Welcome to Identiverse 2025. We're here recording live from the CyberRisk TV studio on the expo floor at the Mandalay Bay Convention Center in Las Vegas. I'm your host, Adrian Sanabria, and joining me today for this interview is Chip Hughes.
Hey.
How are you doing, Chip?
I'm great. Happy to be here. It's already looking like it's going to be a great week, so it's exciting.
Yeah, I think they're still putting together booths and stuff like that. So it's an interesting conference. We've already had some workshops today.
Yeah.
We've got keynotes tomorrow. Tomorrow's going to be the big day, though.
It's awesome. It always feels like Old Homes Day in some ways, too. You just walk through and see a lot of people have known for a long time, so it's always great to be here. It's exciting.
And you are the Chief Product Officer at Imprivata.
That's right. For about a year. It'll be a year this month. So exciting times. Been in the space for a while, and Imprivata's been a great place to be and excited about what we're doing. So
love talking about product. You've got several product lines, but most excitingly, you get to play in a lot of spaces that are really messy, like the stuff that's really fun to talk about. Maybe not for the people doing security in those environments, but I love talking about this because there's just a lot of chatter in the industry about, if only we just did this. You sprinkled some AI on this or did something over it. And then you pull out, well, what about hospitals?
Yep.
What about manufacturing? What about retail?
Yep.
What about all these occasions where you can't put in extra friction, or you can't force people to type a 32 character password or something like that.
That's right.
Yeah.
And it's been a lot of fun. We are primarily an Imprivata. We're in 90% plus of the hospital systems here in North America. We're a global company.
90%.
That plus. I mean, lot of hospital penetration. And you think about the criticality of care and the nurses, the clinicians, the doctors that have to be able to go through. They want to be able to see as many patients as possible to provide that care. We've got real issues in terms of shortages, making that experience for those doctors, those clinicians as seamless as possible. And those things apply in other areas too. We have airline pilots that have to be able to go, they have to carry iPads on their planes. How do you solve these challenges where you have shared devices, shared infrastructure, but you need to be able to give that seamless, quick experience that's secure? And that balance has always been a real challenge, and we're trying to eliminate that decision and make it really easy for our customers to just provide that care, have seamless access. And when you get into that shared world, it's a lot of fun. And particularly if we're talking healthcare, a lot of old stuff and a lot of new stuff, so you're balancing a lot of different pieces of infrastructure and apps and integration and those sorts of things.
And I'm not sure how much the average person knows about how healthcare works, but like in large hospitals, most doctors are not employees of the hospital, right? They're contractors.
They can travel. You have lots of different situations.
They bring in their own devices. They connect them to the network.
That can be true too. So, and it's interesting, especially I think of nurses a lot and how we deal with nurses. So you have traveling nurses that can come in.
Right.
You have nurses that are obviously hospital employees. And so most people have heard of Epic as one of the major healthcare, back-end systems that we provide. When we're thinking about Epic, they want customers to move to start using their mobile applications as the way that they go provide care. And it's interesting, if I'm a hospital and I have to provide a mobile device to all of my employees, what does that look like? You've got doctors often want to use their own. You've got nurses may or may not be able to use their own. So we have union laws that sometimes prevent it. We don't want.
I didn't know that.
We have PHI data we don't want to have leaving the hospital potentially.
Right.
And so it's been really interesting for me as I've been on this journey looking through how can we deal with this shared set of ecosystem, shared mobile devices, do assignments that work. And even if you think nursing, beyond nursing, we also have things like EVS staff, the people who go clean up the hospitals. You have other folks that are doing IT operations. So it costs hospital systems a whole lot of money. And one of the things we're really focused on is how can we provide secure access in a cost-efficient way so you don't have to go necessarily buy a phone for every single user and deal with, I left my phone at home, those type of things, so that nurses, doctors, that type of staff can still provide that access. And so you get into these challenges, you need to have passwordless authentication, you need to have seamless experiences, and it fits right into that identity paradigm, but it is sort of its own sliver within that world, if you will.
Yeah, it's interesting. When Mark Andreessen did his whole software's eating the world thing, I think was 2013, 2012, something like that.
Yeah.
Like he revisited that 10 years later and judged himself on it. He said, I think I was largely correct, except for healthcare. And it's interesting. We are now seeing healthcare kind of come up into complete some of that digital transformation. And I wonder, when you go into environments, so it sounds like for a lot of it, you're not just selling a product or a service. Like you have to help them architect and engineer what the workflow is going to look like, how the employee is going to use it. You have to think about all this stuff actively. You can't just, okay, here's your licenses, go have fun.
Nope, that's right. And so it's been interesting. At Imprivata, we actually have a chief medical officer.
Yeah.
And we have a chief nursing officer, and part of what they do is they help design workflow. They go to our customers and they'll do walkthroughs and say, here's where we can optimize our solution. And as we look at getting into other verticals, because we are in the commercial space, we're in manufacturing, we're in these other things, we do look at, do we need to bring somebody in that is a specific specialist where we can work through these sort of non-desk workers and make sure we're giving that optimal solution. And so it's something we really focus on. But I first joined the organization and I went, chief medical officer. It's a guy named Sean Kelly.
Yeah.
Great guy. What is this? And then you sort of start working with it, like, oh, I get it. It's really important you understand how these things work to sort of solve their problems at scale.
Yeah, I imagine in a lot of those organizations, maybe they've heard some pitches before and they're like, it's not going to work. We've tried that. So you need that kind of credibility on staff where somebody said, no, it can work. And, here's some customer case studies. We've done it over here. That's how we know it can work, right?
That's right. It's case studies. It's having the people that do it day to day. It's for us, doctors, pharmacists, those sorts of things on staff where we can go in and build that credibility. And it's been interesting too. Healthcare, I spent a lot of time in other verticals doing other things. The quality of our product and the expectation when you're dealing with people and delivering healthcare is just second to none, right? Some software companies sometimes have some bugs. That's kind of acceptable depending. You have one issue where one patient record has been compromised. It is truly a huge deal across us from a company perspective. And so what that really drives is we've got to give that productivity. We want our doctors and our nurses to be able to deliver quality care, to see as many patients as possible, to when they get home, they talk about pajama time. I'm putting my notes in that medical record system. We want to be able to provide that seamless access, but our solution also has to be secure. So if that doctor is badging in, badging out, and putting those notes in, it has to be for the record of the appropriate patient.
Right.
Because if it's not, right, it's really a problem.
Oh,
so we're really focused on...
We don't want the wrong organs getting taken out.
I would say it's not this leg, not this leg, right? But what it drives for us is how do we provide that really efficient access, but also security is a big deal, right? Ransomware, if you go talk to a CISO at a hospital system, they'll talk to you about ransomware for hours and hours and hours. And so you're dealing with legacy stuff. You got to have seamless passwordless access and figure out how to solve those challenges. We've been doing it for a long time.
And I love you mentioned pajama time because you have to understand that culture and part of this job is gonna, same thing in education with teachers. Like a lot of their job has to happen quiet times on the weekends, in the evenings. There is no time in the building at the school to get this kind of stuff done.
That's right.
So they got to take work home with them, and you have to deal with that from an identity perspective.
And that's where part of our strategy is. We want to solve that clinical use case where we bring in our team, really understand that, but we also want to be able, an identity and access management company that can extend to how do we do remote access most appropriately, more commonly that we've seen. How can we solve some of these knowledge worker problems so we can use the same set of tools from a platform perspective to deliver that seamless experience? So it's been a fun journey, and a lot of what we're doing, we're driving a lot of innovation, so it's been a lot of fun.
There's a marketing opportunity there with pajama time. There's something there.
Well, we have it's
stickers.
It's great.
I'm not sure what it is, but
we talk about the cognitive piece and giving people breaks on that front too, right? Because if you think about doctors, you're working, you're thinking all the time, and how do we give you a break?
Switching.
Yes, that's right. That's right. So it's important to us.
Yeah, you can only switch so many times before you get burned out, and you get slow. You start making mistakes. Yeah. So, two things I want to cover before we have to wrap up the conversation here. What do these environments generally look like when you get in? Is it that they're secure, but things are not convenient? There is a lot of friction, or there's just not a lot of friction because it's insecure. So, so I want to talk about that, and then I want to talk about what the ideal environment looks like what it looks like when you're done with it.
Yep.
You know, if you can get it done the way that you want to.
So it's a couple different things. So, you know, we're privileged to have a really large customer base, which is great. A lot of our customers are using our, what we call tap and go solution. So I've got the badge, I walk up to an endpoint, so that could be a desktop, maybe next to a bed. That could be if I'm walking into a manufacturing floor, I need to clock in, clock out. Great, tap the badge, I'm logged in. Usually the first time we do that, we want the user to have some sort of second factor for authentication. So they'll put in something like a password. And what we do, we then sort of unlock a trusted period of time where we'll let you then walk around and just use your badge. So use multi-factor once, and then you're in what we call a grace period. And that doctor or that nurse or clinical provider can walk over and just tap in, tap out, and we trust the badge at that point. And that works great, but you get into some of these awkward conversations about, well, how long should that period of time be?
Right.
When do I need to step up? Do I have this concept of risk? Is a doctor or nurse accessing something they haven't accessed before? Those type of things. And so what we're building is more seamless ways to add a second factor of authentication on top of that. So we've been very focused on facial. So can I now have a doctor walk in or a nurse walk in, tap a badge, use a face as a second factor? All of that's passwordless, right? We still see this challenge where there is legacy stuff, like I said, that exists in these hospital systems. It's just going to be there.
Yeah.
You know, I'm going from a 15-character password to a 32-character password.
Imagine you've got some pin codes on a Chronos or something.
And people
like that.
people are posting. It just doesn't work. I'll share another story about our mobile solution in a second. But so we want to get to a place where we can make that really seamless, and we're thinking about, you know, push notifications to phone. Where can I use face? And part of what we're building is we want this passwordless experience to be able to work with you across all of your functions. So I work at home, we were talking about, I'm on a personal PC, I want to be able to use that face in whatever factor we want. I'm going in, tapping, use face. I'm going in and checking out a phone, tapping, use face, or whatever authenticators we want. And so that's sort of the ultimate end state. You know, we talked a little bit about mobile. We want to be able to go check in and check out these mobile devices. Yeah. And when we go through,
I've seen these carts where you have like dozens of mobile devices.
We do.
And they all plug in and they charge, and you just grab one off the cart, right?
It's a very cool experience. Yeah. So you walk up, you tap your badge. And I've seen too, you have this problem. Before we let you use that badge tap, we do want you to use that password one time. Yeah. Well, if I'm doing it on a mobile device and it's 16 characters, that's not great. So that idea of portable sort of facial authentication following you solves a lot of those challenges, right? We would have 2 lines, one to log in that first time and then one to go get your mobile device. So it's optimizing that experience, whether it's healthcare or another use case, using passwordless and driving that, and helping our customers understand how to adopt those technologies, and starting with the most valuable things either from a user or a risk perspective. And then the other piece, like I said, is layering in other components to start looking at risk. So what is normal for a user, very specific clinical UEBA, and then more classic what we see from a market perspective, things like, does this look like a known attack, known attack pattern, those type of things, and layering that into our tool as well.
Yeah. So. Yeah, and it's interesting hearing about UEBA. I remember it was big, like 2012, we were talking about, all the SIM vendors were talking about it, and it was just maybe more than we could handle at that point, or we went through it. I like to say there's not a lot of really bad ideas in security. Yeah. There's just poorly executed.
I agree. For us, one of the things we're focused on is we have unique data sets in terms of we can look at our clinical providers, we can look at users, understand what they're logging into with their badges, and we can start comparing that just for what's a normal pattern. When does this user actually badge into this set of workstations? We can tie that back to hospital departments as an example. All of a sudden, if I'm Chip at a different department than I usually am, we want to be able to detect that. And then we have some cool...
Surgeons shouldn't be going into the boiler room in the basement.
That's right. And we have some other things around patient privacy type data. So I'm Chip, maybe I tap in, I'm trying to access, some famous actress's record. Maybe we need to go identify that quickly. So we have all of those pieces in place now to really help both with compliance and driving just better security and better privacy for our patients, which is great.
Yeah, and I imagine if you can get it right at a hospital, I mean, that's such a challenge. It has to be a public area, right? So you're down to room by room, like security at that level. I think it really is one of the more challenging ones from both a physical and digital
And
perspective.
the thing that I think is cool is actually walking away. The logging in some respects, is the easier part.
Yeah.
It's how do you deal with people walking away? Not everyone's always going to remember that they have to badge out. They may just want to walk
Right.
away from a machine. And we talk a lot about hospitals of the future, sort of, all these other pieces of the future. And just this idea that we can inherently build that with what we're doing based on face. Care at
Yeah.
home. How do I tie a doctor back to an inpatient and providing care at home and doing authentication on that? And so it's a really cool future in terms of what
in
we're
a way
able to
that
drive
where people don't freak out about privacy.
Well, that's
right?
exactly right. And
Yeah.
and it's interesting. Different generations have different views, and
Yeah.
that's part of this too. Is what are people willing to accept, and how does that work? And so we're
Yeah.
working through all those pieces.
Great stuff. Thanks again for joining me today,
it's
Chip.
awesome.
I enjoyed the
Excited.
conversation. In just 15 minutes we've been talking, already learned a bunch of things.
Cool.
Which I love.
It's great.
Yeah.
So it's great. Great to be here. Thanks.
To find out more about Imprivata, please visit securityweekly.com/Imprivata IDV. For all Identiverse 2025 coverage by Cyber Risk Alliance, please visit securityweekly.com/IDV. And thanks again, Chip.
Yeah, thanks. Awesome.
Have a good conference.
Yeah, you too. Take care. Thanks.